Doc, thank you so much for giving me your
Thank
time.
you.
It's a pleasure to chat with you as
It's
always.
my honor.
I want to start off with really basic questions.
Sure,
Right?
go ahead.
There is aesthetic surgery, there is reconstructive surgery, there's cosmetic surgery. Can you tell us the difference between?
So aesthetic and cosmetic are similar.
Okay.
But aesthetic is a more refined way of seeing it. And then there's reconstructive. So plastic surgery is a very vast field. It's like for burns, cancer reconstruction, congenital deformities like cleft lip and palate. Then there is hand deformities and hand injuries. Then there is, post-trauma reconstruction. So all those fall under reconstructive. But when you want to enhance your features or you want to do something for beautification, then it is an aesthetic procedure. That's a very thin line. Like, there are certain procedures like breast reduction. I don't consider it as a aesthetic procedure. It's more of a reconstruction because it's abnormally big and you're reducing it or the patient is not happy. Or even if you have a girl with small breasts. Have you seen how people make fun? Their own friends, girls make fun of other girls. Oh, look, that flat chest, a carom board has come or whatever. And that affects that patient mentally. So then what would they do? So when you have a large breast and you have to reduce it, the patient feels nice. So it's not cosmetic. Again, I consider it as reconstructive, though the insurance company says it is cosmetic. I think it's reconstructive. So basically for beautification, etc., what you do, like you fix your nose, you fix your eyes, or you're looking younger. You want to look younger when you have aged. So that's all aesthetic. You do Botox, you do hair transplant. That's all aesthetic.
So there's a difference between the elective surgeries, so things that I can opt to do even though I could choose to live without that work. And then you're saying the reconstructive surgery. So someone's had cancer and has had to have surgery to cut out that cancer. Then
yes, then you reconstruct it to fill that gap, especially like a tongue cancer or a jaw cancer. You take off that entire area, you take off the bone, you take off the teeth, you take off part of the tongue, you take off part of the cheek. Now, the patient can't live with a hole there. So you need to fix that up. So you use the fibula to reconstruct the mandible. You use the skin from the chest or from the arm. And, the skin part has to be reconstructed. So that is reconstruction.
So what made you take on plastic surgery?
Well, I was supposed to be a cardiologist. I was influenced by a cardiologist from my building to take up medicine.
Okay.
And then I went and I did a post after MBBS in a hospital in medicine. And I found it extremely boring because all I did was I went for rounds in the morning and saw that this one has got fever, this one has got constipation, this one has got chills, etc. Afternoon, you come, you check the same thing. Evening, you come, you check the same thing. One day, one of my friends who was doing surgery asked me, just come into the surgical ward. Can you help me out? So I said, okay, chal, I'll come. I want to see. And that's how I gained interest. I left that field. Next thing I joined was Lilavati in a plain post. First thing they put me in plastic surgery with one very famous doctor called Narendra Pandya. So he was doing fantastic work. And since I thought this was very artistic what he did. And I loved it. So that's how I took it up.
So you consider it art?
Yeah, yes, of course, it's art. Aesthetic surgery, even reconstructive surgery is art.
How? Tell me how.
Now, you're trying to make a person look as normal as possible. You need to have that sense to understand what is normal, and try and make it aesthetically pleasing. If you see the difference between a plastic surgeon suture and a general surgeon suture, it's totally different. That means stitch a wound. We stitch it, we put our incision in places where it is hardly seen. Well, the other units, with all respect to them, they don't put it in areas because they need access to that certain organ, they'll just go cut open and they'll just stitch. So we try and make it more beautiful. So in aesthetic surgery, like I like to do only aesthetic surgery, I consider my patient as a piece of art, like a statue, which I need to reshape and make her or him look aesthetically more pleasing to the eye, which they are not, which they do not see themselves as. So that's art again, isn't it?
Is cosmetic surgery the most lucrative?
Yeah, it is.
And that doesn't hurt, I'm sure.
No, that doesn't hurt. Yeah, that doesn't hurt. But now with the competition, but...
Is there a lot of competition?
Yeah, so the problem is our race in India, cosmetic surgeons face a lot of aesthetic surgeons or plastic surgeons who practice aesthetic surgery face a lot of competition from countries like Turkey, and we have a lot of influx of patients coming in from the UK, Australia. But for the price range, we face a lot of problems with Turkey and Thailand. I think their rates are as in par with us or slightly less. And here we end up paying GST. There they don't have.
Okay, so in India, there's GST,
GST for aesthetic surgery.
on aesthetic surgery.
Yes, only aesthetic surgery.
But no other kind of surgery.
No, nothing else.
So you are the caramel popcorn of
Yeah.
your sector.
Yeah, caramel popcorn, correct. 18%.
You pay 18%
Yeah,
GST.
true.
Do you have right now, I mean, given what we're seeing on Instagram, and there's a lot more exposure to your field of work because of social media than I think there was.
Because
ever
it's
before.
glamorous, no?
Right. Is there a change in the demographic of people coming to you? Younger women?
There are kids coming nowadays, which is
Kids.
very disturbing. They come with fake IDs, and they come for fillers, and they come, they have a little, so they have this craze that they will not eat. They don't eat food. They want to be that thin, slim, super A- size or 0-1 size or whatever. And they're so malnourished, and they've got sunken eyes. A young girl of 18 or 16 would look like as if she's 21, 22, or look sickly. Then they have these tear trough deformities, they have hollow cheek. Then they want me to put fillers for them. The skin quality is so bad. They start smoking. I don't know what kids are doing smoking so much. The skin quality goes bad. Then they end up with wrinkles. They come for Botox. I have had a girl who was 18 and she had a false card who said she was 25. I happened to know who she was because she was my son's friend. And she didn't tell him she's coming to me. And I caught her and I said, no, I'm not going to do it. That's how I got to know that. I was shocked.
Yeah.
So I asked my son, he's 15. So I said, what is this? What's going on? He said, yeah, Papa, many of them do. You shoot that girl away. I'm like, I did. I'm not going to do it. It's not, if the parent comes and if there is a psychiatrist who says that the patient needs it, then probably I'd do it. But you're living an unhealthy lifestyle with some crazy diets you'll follow from Instagram. And you want to look like that influencer, and you want to look like this influencer. And what is ridiculous, yeah.
Do you have situations where you have a psychiatrist or you have a parent saying this person needs elective aesthetic surgery in order to improve their mental health?
Yes.
Give me an example.
One is for a nose, where this girl, very pretty looking girl, and she had a nose looked like a pug dog, what's that, boxer dog, it goes in like that. So she was really depressed about her nose. She was really pretty outside. So then we did a rhinoplasty for her. She needed it. She was 16 and she was really depressed. Another girl that we spoke about was a girl with big breasts. She was slim and her breasts were like F size. They were this big. The amount of fun, her friends were making, teasing her. She was on antidepressant pills. So my psychiatrist friend referred her to me and said, Aamod, kuch kar yaar uska. So I said, okay, if you're giving me clearance, I'll do it. And then he says, she was nearly suicidal. He said, Aamod, she has thrown the tablets away after you have operated and she's doing fine. I reduced the cup size. I said, listen, I told the parents, there might be a problem with lactation later. He said, we don't care. We want our daughter. We can't see her go through this. So, okay.
There used to be a time also where aesthetic surgery or plastic surgery, as we used to call it, was only for film stars or for very rich people.
That's the aesthetic part of it.
Yeah, that's no longer the case.
No, not at all. Not at all. People are more aware. So they come and they get it done. There's nothing wrong. If you lose weight, your body sags. You have a 20. Now, you see, I operated on a 28-year-old girl. She underwent bariatric surgery. She lost about 40 kilos. Now her body, if from here up, she looks young. From here down, she looks like a 60-year-old. She can't go on. Her whole sexual life, everything will go for a toss when she looks at herself. So that is fixed. I can't show pictures here, but I would have shown you.
But there are rules, right, in India? And because I can see now on social media that there are a lot of doctors overseas who do a lot of before, after.
Yes, we are not allowed to do it by the new board.
What are the rules for you?
So you're not supposed to put up before, after pictures, even if you have the consent of a patient. But apparently now it's changed. But you're not supposed to do that.
And you can't advertise.
You can't advertise. That we can't advertise. We could never advertise. Yeah.
Also, in your particular sector, then your patients also don't want to say it.
No, here, especially the Indian patients don't talk about it. Very few of them talk about it. But if I have an patient from the UK or in Africa where I go and operate, they go and they just spread the word. They go and say, hey man, I got a tummy tuck done. And I have a French patient who If you see on YouTube, I think there might be a video of her. She's come on video and said, I got a breast implant done. I have a supermodel who keeps on, promoting me left, right, and center because I did a breast implant for her. And she's like super happy about it. And she's Australian, she's not Indian. So they go ahead and they're totally bindas. They don't care. Here we have, because I think people still perceive cosmetic surgery as a taboo.
Why is that?
I have no idea why. See, if you lose weight, and now if you have loose clothes, you go to the tailor and fix it.
Yeah.
Correct? Now, if you're going to look at yourself in the mirror and you got loose skin, what are you going to do? You're going to come to me, right? Or come to some aesthetic surgeon. What's wrong in that? I don't know why it's considered as taboo, but I think that's changing now.
But I feel that, and I was just having this conversation with someone before we came in about, let's say a woman has had 2-3 children.
Yes.
And that takes a toll.
Of course.
On her body. And she feels the need to literally put it back together.
Of course.
How is that different from coloring your hair or doing your eyebrows? Because it
not.
all goes to making you feel more
It's
confident
not.
and making
It's the same.
Right?
Yes.
But is there for you an aspect of counseling to what you do? Let's assume the patient is above 18 and hence does not need anybody else's consent. But if you feel that, okay, hang on, there's some dysmorphia.
Yes.
People are coming to you with vulnerability, and you feel that you don't need that surgery, but there's something else going on.
So I do tell them they don't need it straight away. There are sometimes some people come and say, I need to fix my nose. It's not looking great. I said, I'm so sorry. Your nose is looking fine. There's nothing. You point out to me what exactly you don't like about your nose. They're not able. No, it's just I don't like it. I'm like, just I don't like it means why? Is it too big? Is it too wide? Is it too narrow? What is it? They're not able to tell you. Then I said, you know what? Don't do anything. Go. Your nose is fine. Then they say, no, you need to do something. I'll go to another surgeon. That surgeon said he will do this. I said, do one thing. Go meet my friend, speak to him, and he will make you appreciate, at least teach you to appreciate yourself. If you still feel you need something, if you're specific, then you come back to me and I'll do it for you. So 90% of the time when they go, either they don't go to another surgeon because they didn't like what I said, or they go to my friend and then they realize that they don't need it. There's no point in operating a patient aesthetically because, see, a patient who comes in for an aesthetic procedure is a client. He becomes a patient after I've operated. He's not suffering from anything. After I operate, he's pain. He's got pain, he's got bruising, he's got everything possible. Yeah. So I need to be careful. At least I do that. I see that I only do it if it's really needed. Otherwise, no.
And so in the Instagram era where we have people taking weight loss drugs, we've got people,
the new Mounjaro and
the the Ozempic and things like this. Does that go hand in hand with then coming to you and saying, yeah, but I also want to fix all of these things?
Yeah, it does. So they lose weight. Then these drugs are good drugs, Ozempic and Mounjaro. And if given right for the right patient, it works wonders. But yes, there are after effects. There's loose skin. Like how if you undergo a bariatric procedure, you will lose weight again. Again, your skin will sag. So this happens in patients. And it's just like if you're overweight, you've not had children, then the stomach sags with Mounjaro and Ozempic because you've lost about 10 kilos. So that part sags, and that if you have stretch marks, the skin is never going to tighten. So people exercise, I'll go to the gym. So go to the gym, exercise. It come back to me in 3 years' time. If it goes, great. If it doesn't, then I'll fix it for you. So if you have stretch marks on the skin, it's not going to go, whatever you do.
What is the most common procedure people come to you for in India?
Tummy tucks. For surgical, it's usually tummy tucks. I do a lot of tummy tucks, lot of breast lifts. Tummy tucks and breast lifts is what I do the most in India.
And is that different from other parts of the world? Because you also practice.
In Uganda, even there, I do a lot. There, I do a lot of butt enhancement. Though they have very large butts, they want even bigger butts. But that's one place I do it because it is a culture there to have big butts. And then they have in Uganda, there was a time when quinine, they had a endemic of malaria, I think, and then they gave quinine injections intramuscular. And all the patients have got these indentations in the buttocks. So you're not supposed to give it. So they all come to correct that. A lot of it. Though they have large butts, when you look at it, when they're naked, you got holes in it. It's like, craters.
Oh, not like dimples.
Craters.
What is the most challenging procedure that you have to do?
No, nose job for me is the most challenging.
What?
Yeah, because it's like a different organ altogether. You might heal differently in your tummy or your breast or your face. But a rhinoplasty, a patient, if it goes wrong, it goes terribly wrong.
Mm.
Okay, and then the nose heals in a total different way.
So you do a surgery, but you're not really sure what it's going to look like until after
No,
the
you
swelling
are
comes
sure.
down.
No, you have an idea.
Yeah.
But it can just go wrong if a patient is a smoker,
Mm.
if a patient has diabetes, or doesn't follow your instructions, then it can go terribly wrong.
Do you have men coming to you?
A lot of men, yes.
What procedures? How is that different?
Gynecomastia, man boob reduction. That's one of the most common, yes. And hair transplants. So I don't do too much of hair transplants, but yes, they come for, and nowadays they want to make their round faces more elongated. So they want buccal fat removal and chin implants and jawline contouring. So I do that for them. And most of them are corporate honchos who give a lot of talks, yeah.
So tell me what, on an average, and we've seen the trend of faces change, right? So what are the procedures being done right now for faces?
For face,
Yeah.
so you have eyelid surgery, eyebrow surgery, eyebrow lifts.
And what does that do?
So they want an arch. So you give them this arch,
Okay.
And they want cat eyes. Girls want cat eyes. So we give them cat eyes.
And how does that
It's
happen?
a canthoplasty. You go down here and there is a ligament, a canthal ligament. You lift it up and stitch it up.
Okay.
And fix it and make it like a cat eye. You can do it with Botox as well by controlling the muscles, and you can give that, but a surgical one gives you a much more refined one.
And what does the eyelid do?
So you have a double eyelid. People want an open eyelid, like you have patients from Assam, etc. Because they have the single eyelid, they cannot put eyeliners and stuff. So then we give them the double eyelid. So that's what eyelid bags. Some people have bags when they grow older. So we take that out and make it look more younger. And then we do facelifts and lip jobs. So they want a lip lift. Now, many of them don't want to do fillers. So we do a lip lift surgery for them.
And also, from what we're seeing right now among celebrities, particularly overseas, the facelift has changed completely. Or the procedure in which it was done has changed.
Yeah, but see, what happens is you cannot, though the surgery is meant to make you look younger, the body undergoes a lot of changes. The bone gets resorbed, the fat consistency changes. Then half of them take all this Ozempic, and they take Mounjaro, and they do a lot of cocaine, and then they do, they do it.
One assumes, yeah.
Yeah. So that changes a lot of things in your body. And then you want to look like how you were when you were 25. It's not possible. So they try to do that and they overdo stuff. And there are some doctors who do it for them.
So there is also, like you said, fillers right now are mostly non-surgical, right?
Yes.
So there are non-surgical ways to do this, and then there are surgical ways to do this. Which one would you, at what point does someone go in for a surgical procedure?
When the laxity, you judge the patient depending upon the laxity of the skin. It's by feel and touch and experience. Like, a young person or probably in the 40s who doesn't have too much of laxity, I would probably do fillers, threads, etc. to give the result what they want. So you pull back and you see what are you going to get. If it goes about 2 to 3 centimeters, then I do a facelift for them.
Okay.
Because I advise a facelift, but that's up to them. Then some people say, no, you know what, sir, doc, just put in the fillers. And I said, okay, fine. But there's a certain amount of fillers I can put in. So you see, when you fill up something, it tends to pull back. Correct? Because it's lifting from here. So suppose there is a deep nasolabial fold, this line. So you fill in here, and then you fill this up here, then this gets masked. So this looks less. And usually in people with deep nasolabial folds, you'll find that this area is also hollow. So you fill this up. So it makes you look younger. But then how long are you going to keep on doing fillers? So then you shift to the surgical aspect. The surgical aspect lasts longer. So a person in the 50s would look like as if they're 40s. So it goes on like that.
What is the latest innovation in your line of work right now that you're really excited about?
So all of them are this non-surgical stuff like the exosomes and PRPs and fillers. Other than that, there are many of these non-surgical instruments which have come out, like HIFU, and I don't do all those. I usually am a surgeon, so I operate and I do most of the surgical work. But that's done by many dermats and many other colleagues of mine who do it. And they work really well to some extent.
So when I was reading up about this, all the different kinds of surgeries that are available, for facial surgeries, the one that I thought was the cutest was dimple creations. Have you ever created a dimple?
Many.
So
Many.
You can actually have a dimple placed in. How does that work?
So how is a natural dimple formed? Now, there is an abnormal attachment between the muscle over here and the skin.
Okay.
So when you contract, when you laugh and the muscle pulls it up, the skin also contracts. So you recreate that connection. So you go in from here, you put a line from the lateral side, from the outer aspect of your eye, right down parallel to this. That's where usually the connection is. And you go in and try and attach the inner part of your skin onto the muscle with a stitch. And that forms a dimple.
That's adorable, actually.
Yeah.
So people can actually have dimples placed in.
Yes, you can.
And they last
They
rest
last.
of your life.
Yes, they will last.
Stitch lasts the rest of your life. That's so cool. What trends are you seeing right now among what people are asking you for? And
So
that changing?
I had a lot of patients in men who come to me for high definition liposuction. That means they want 6-pack abs. And they don't want to take anabolic steroids and they don't want to take fat burners, etc. to gain. Because sometimes some people who even exercise a lot, that one layer of fat is always there. It never goes. So then they have to take these fat burners, etc. to decrease the content of fat in their body to enhance that look. And that can cause problems. That can cause cardiac arrhythmias, etc. if you take too much of it. So then they come and they ask me to do a 6-pack ab liposuction, etc. And I do that. I've seen many recently happening. They're more aware and they want entire body sculpting. So they want the deltoids, they want the triceps. When they go to the gym, they want to flex, but they don't want to take, at least they don't want to take these anabolic steroids, etc. So I've seen that happening a lot now.
But the 6-pack, and I remember reading about this, is that, when movie actors have to do that shot with the 6-pack, they actually cut down on their water intake and everything.
Yes.
Because it takes a lot of effort to look like that.
A lot.
And you can't look like
calorie deficit diet.
You can't look like that all the time. So they do it for that shot. And then they go back to...
Many factors have done the liposuction.
They have done the liposuction.
Yeah.
But so then, isn't that then a sort of unrealistic expectation to set in for people?
See, what happens is, so I'll tell you how fat is in the body. Fat is arranged like grapes. It either in the body, the fat cells, the adipocytes, they increase in size or they decrease in size. They don't increase in number. So you take off the fat from a certain area of the body, it's never going to come back there. It can get deposited somewhere else, the fat content. So when you take off the fat in such a way around those muscles that the muscle gets augmented. Now the guy can always look like that. If he's exercising and leading a healthy lifestyle, then it's good for him, no? Then he doesn't have to go on a negative water diet and negative calorie diet and take all those drugs, and it's good for him. It's beneficial, no? On the long run, if you see, it's beneficial.
Fair enough.
Yeah. You want it, so it's okay. That's aesthetic surgery now.
That's aesthetic surgery. That's actually, so that's the conversation to have, right? Is there a dotted line? Because this is elective surgery, so you're putting your body through something. Like you said, they're not patients when they come in, they're patients when they go out. Right? So they're opting to become patients. They're opting to have surgery that you'd be perfectly healthy living without.
Yeah.
So is there a dotted line of, I won't go past this, I'm not going to do that, or I really probably think you shouldn't do that? Or you just think that, hey, if this person wants to look like this, who am I to?
That's one way of thinking. I can always say that, if it's going to look, if you want to look like that, fine, I'll do it. But now you have to judge when you're consulting a patient, you really need to see by now. I understand if this what the patient really wants and really needs, and what they're actually asking is it good for them or no? I tell them, I give them the option, like, look, this is not going to look good on you, or you should not be doing it. Many of them actually appreciate a honest response and say, listen, I'm not going to operate on you. Like, there's this girl who's been harassing me for the last 1 year to increase her breast size, which I said, I'm sorry, I'm not doing it.
Why not?
Because it's fine for her body and her skin is tight If I'm going to increase it, first of all, it's going to look abnormal. Then she wants an 800cc breast implant. When she's thin, she's going to end up with backache and neck ache. And then the skin is she doesn't have enough skin to put an implant that size. And then I'm going to end up with a complication. She's going to suffer. I mean, and I have to look after her after that. I said, listen, I don't want to do it. You go to somebody else. No, she still keeps coming back. Doc, will you do it? Will you do it? I said, no, you can ask me 1 year again. I'm not going to do it. Now she stopped. For the last 2 months, I've not got a message. But yeah.
So there is a line of
you have
much
to
is too much.
Yes, but you can only draw that line once you speak to the patient. Like somebody comes and says, I want to look like Shah Rukh Khan abs. So I'm so sorry, I can't do that. Or they come with Angelina Jolie's face and they say, I want to look like that. I'm like, I can't do that for you. There was this new trend of putting in body implants. Have you seen that? I don't know.
No.
On Instagram, they have a huge open ring and you can see through. Crazy stuff. Corneal tattoos.
Ouch.
Yeah, so they put a slit in and they put this heart and all into your eye. Imagine that. Crazy stuff. So those things, I don't do all that. It's like utterly crazy.
So for someone who is opting for cosmetic or aesthetic surgery, what are the questions that we should ask the surgeon?
That depends on the procedure you're going to do. So if a patient has to ask, is it first of all, what is going to look good for me? First, the patient needs to be very honest as what they want and why they want it. Like they say, look, if I've got I've got really small breasts, or I've got my shoulder looks thin, or my legs are too fat compared to my body, fine. If it's true, then you undergo it. I have been working out, I have been exercising, dieting, and nothing is working, fine. There are people who think that this is a shortcut. You don't do it. As simple as that, because it's going to come back. You do a liposuction for the thighs and bum and hips, and they are not going to exercise. They'll gain weight somewhere else. The fat will accumulate. So when the patient meets the doctor, first be very clear as to what you want. Do not lie to the doctor. And if you're smoking, please tell the doctor you're smoking, because the smokers always heal really poorly. That's one thing when many of them don't tell us, and then later on I get to know. Then always ask about what am I going to look after so many years, or what is going to happen, and what are the complications of a procedure. Every surgery can have complications, but in cosmetic surgery, I feel the complication rate is less than you crossing the road in Bombay and getting hit by a rickshaw. You've heard that.
Falling into a ditch.
You're falling. Yeah.
No,
yeah.
So basically, if you are going in for a surgery, be very clear about what it is you want. Communicate clearly with your doctor about what you want. Be honest.
Yes. And don't go in for a procedure because somebody else has told you.
Okay.
I had this boy who came to me crying, saying that my body is not looking nice. I'm looking odd. And I'm like, I didn't find anything odd in it. He was actually well structured. Then I kept asking him, why do you want it? No, I'm feeling this. No, my love handles are big. I said, it's just slightly big. It's nothing much. You don't need surgery for it. And I kept asking him, and he was harassing his parents. He was 22. And then I realized that his friends were bullying him. I said, you don't need it. Change those friends, and then you'll start loving yourself. There's no point in doing the surgery. I wouldn't have got any fat out. I would have, that patient would have got, pain, etc., undergone the entire surgical procedure. And with what result? With 2% improvement. What is the point? I'll make my money, but that's not the right thing, no?
You've actually mentioned friends bullying young people 4 times so far. Is this
It's a common trend. It's a big trend here. It happens so often. Even gynecomastia, man boobs, the boys are crying, half of them, when they come. We are nasty. Humans are nasty. Come on, I've also done it when I was a kid. I remember I've gone and apologized to a friend of mine because he had a big chest. We used to go and press it in school when we were in the pool. We have done that. I think half the guys over here also would say they've done it. So
bullying in schools to a point where the child is being driven into depression and parents suggest cosmetic surgery.
Yes.
This is a frequent thing.
Yeah.
Wow.
It's quite, I've had a number of patients like that coming to me, yeah.
That's actually really like.
But we do it after
a
getting
parent,
a
it's really scary.
psychiatry, because they can't see the child like that crying every day.
And schools are not able to do
Now,
anything.
what can they do? I mean, they can educate the children, but children are children. They don't really understand what they're doing. It's not that the kid who is a bully is a bad person. He just doesn't understand it and he finds it funny. And no one has told him it's not funny. Though we do try and educate them, it comes out. So we can't really blame the child, oh, you've been brought up badly. No, it's not.
Yeah. What if you were to actually imagine what your line of work would look like maybe in another 10, 15 years? Where do you see that big change, that big innovation? What do you think is going to happen?
Now with the new technology, medical technology coming in, and with the new AI systems coming in, I wouldn't be surprised tomorrow that we are replaced by robots doing the surgeries. With the way it's doing, I mean, the way it's expanding, the quantum physics computer, that Willow computer which is coming out, etc.
What is a Willow computer? What does it do?
It runs on quantum physics. So these are processors which are far superior to any of the we have right now.
Okay.
So even our security system, what we use, encryption, etc., is nothing in front of it. This learning, evolving, even the robotic, it's not as yet reached there, but say about 10, 15 years, I think they will start operating. These robots will start doing it.
So you believe that there may come a time when cosmetic
also
procedures...
tissue cultures. No, yeah. So in that aspect of making doctors useless. And next is the tissue cultures, the nanomedicine, nanotechnology, which is coming up. I mean, they might be able to just target fat cells or, give advanced nutrition to change the, the texture of your skin or the texture of your bone, or repair the bone, kill cancer cells. It's possible. And it's going to happen very soon.
Yeah, because I was having a conversation with someone who said Ozempic and Mounjaro is just the beginning.
Yeah, it's
going to advance to a point where obesity will just no longer exist.
True. Many of the diseases won't exist.
Many of the diseases will go away with it, because if you're able to take away obesity, then you're taking away hypertension, you're taking away
diabetes.
It's
an anti-diabetic drug, basically.
Yeah. And so with that, the human race will then move into a completely different phase of health and mental health and appreciating aesthetics differently. And what will that be for your sector?
I think I won't live that long.
He says it's going to happen very soon.
It's not going to happen that soon. No, but if it's for if it does benefit humanity, I think, it's great. But aesthetically, if they're able to get stuff, but anyway, they will need somebody to administer it and monitor it.
Yes.
Until the AI takes over, it's okay. I have this very strong intuition of thinking that AI one day will take over everything, and we'll be the second in the food chain. We'll be the second.
For aesthetic surgery, what are the most common myths that you think people have in their minds about it?
So one is breast implants cause breast cancer, or breast surgeries cause breast cancer. Now, if you have a genetic predisposition to breast cancer, you have a family history, then you would develop breast cancer, whether you put an implant in or you did a breast reduction, irrespective, if you're going to get it. The implant per se will not cause the breast cancer. Recently, however, I think a few years ago, there was a certain textured implant which caused some sort of a lymphatic cancer, which they brought out numerous studies. So now they've stopped that implant, and now we put either smooth implants or nano-textured, which are not supposed to cause that.
Okay.
But that's one. Then they say that, like I said, if you take off fat from the tummy, the fat goes somewhere else. No, it doesn't. I don't take it off and then put it somewhere else, so it doesn't walk back into you. As I said, the fat cells don't increase in number; they only increase in size. So you take off fat from a certain area, and you don't follow a healthy lifestyle, then it goes. You will. So the body is programmed as to where the fat would get deposited. Some people the abdomen increases, some people the face increases, some people the butt increases. Now, if you take off fat cells from there, And the remaining fat cells which are there would have enlarged to the maximum. Then the fat gets deposited somewhere else. So your thighs might become big now suddenly, or your back might become big. So that's one.
What are the taboos, though, in your...
Oh, they consider doing the surgery as a taboo. Oh, you should do it naturally. See, if most of the people who say you should do it naturally are naturally gifted with a good body. Oh, you see that. Now, I would see so many of my friends, female friends, would say, I don't want to do it. I have got a good body. I have exercised and done it. I said, great. It's worked well for you. You have had one child. The other lady's had 3 children. Her body's never going to come back to whatever if she exercises like you. You are so petite. She is so large. How is it ever going to compare? It's not. She needs help. So that's one of them. This, you can't do that. You can't do that. And they don't understand. Even many of the physicians don't understand. They all say, it's very dangerous. No, it's not dangerous. You are healthy. We check that whether you have, you follow your medical reports are great. Then only we operate. Others we don't operate.
Do you encounter a lot of body dysmorphic syndrome where people are coming back to you to constantly change?
Yeah, there are some people who come, and especially for fillers and Botox, and they want to look younger, but they don't want to do the right procedure. And then they will fix the nose. Then they say, what? My forehead is fine. Now I think I need my eyebrows higher. Okay, fine, I do that. I think my lips are less. I don't want I add more to my lips. Oh, now my chin is less. And then they go on and then they bring somebody else's picture. This person looks like this. And I want to look like this. And how come I am looking like this? The picture they brought is a square face patient and you're a long face patient. Now, how is that going to match? You're different. And then they keep on changing. I want my breast bigger. Now I want this. Yeah, they do that. So there are patients who have operated and they keep coming back to me. I just don't do it. I say, listen, you don't need it now. When you need it, I'll tell you that time we'll do it. Many of them do agree. But then some of them go to somebody else and get it done.
We do have this idea of non-surgical aesthetic work, right? The fillers and things like that has mushroomed across the country.
Yes.
Leaving a lot of times jobs that are not really very aesthetic.
Yeah.
Men with very pointy chins or
right.
It's just faces that look overfilled. Do you get a lot of those patients then coming to you to correct?
Correct. Yeah, I get them. There are patients who come for that, especially chins and when they fill up this area of the face and lips, which are extremely large, and then they want to reduce it.
But can it be corrected?
Yeah, it can be. They can be dissolved. All of these fillers can be dissolved. And the Botox, you just have to wait. There's nothing else you can do for the Botox because it's got a lifespan. So it'll be there for 3 months to 4 months, and then you come back to your normal self, how you were before you did the Botox.
Is there a trend in India for genital rejuvenation or aesthetic surgery?
So it's picking up. One, for females, they want their genital area to look aesthetically more pleasing. Sometimes the labias are so large that, when they're wearing swimming costumes, etc., it comes out on the sides. Or I've had a patient saying it gets pinched between the underwear and the thigh. So you reduce that. The labia majora sometimes looks, shriveled up. So you can put in fat and make it aesthetically more, more pleasing. And then there are people who come for vaginal tightening, who had many babies. So you can tighten the vagina up so that their sexual life improves. Also, there's this new, so they have been sexually active before marriage, and then they want to hide that. So they come for a hymen reconstruction, and we do a hymenoplasty for that.
Is that common? Do you?
Yeah, we do. Yeah, we do.
And is that procedure, how safe?
It's very safe. Okay. It's really very safe.
How long does it take?
It takes 15 minutes to do. Okay. But you need to give some patients, you can do it on the local and a little bit of sedation. But some patients are very anxious, so then you need to give them general anesthesia or a more deeper anesthesia. 15-20 minutes is the max you can. You just need to, sometimes they have the hymenal tags already there, or sometimes you use the vaginal skin, the mucosa, to create it. So it's possible. It's very easy. It's not.
Do you have men coming to you?
Yes. So they want either their penile length increased or thickness. And you can do that. The lengthening procedure, you have to release the ligament. So sometimes what happens is they have got a lot of suprapubic fat. So that hides part of the length of the penis. So you remove that fat. Then they have something called as a scrotal web, where the scrotum and the shaft of the penis, there will be an attachment. Suppose this is the head as an attachment here. So when the makes the penis look smaller. So you have to remove that. That increases again the length. There is a ligament which suspends the penis, which can be cut. But then the patient after the surgery has to wear weights or some exercises to at least for 3 months, so it doesn't pull back. So you can get up to 2 inches in length, and then you can increase the thickness. So ideally, increasing the thickness would work much better for sexual enhancement. So you can put in fat, you can put in fillers. Fillers is an office procedure.
Okay.
You just put numbing cream, you wait, and you put in 20 cc of fillers, and you're sorted. You can increase the head of the penis, the size. If they have problem in premature ejaculation because of the head is too sensitive, you can put in fillers, so that sort of cushions the nerves, so the sensation decreases and they last longer. So that can be done, yes.
How should a prospective patient choose a doctor?
First, you see his skills. I mean, nowadays everything is available on the internet. See his degrees, see his qualifications. And as I said, there are many quacks around who are actually doing fillers and Botox. Now, they undercharge. And see, if you choose your doctor according to cost, you're going to suffer. You need to choose according to the skill.
Okay.
Yeah, and his experience and his qualifications. All that is available online now. So you can easily check up on a doctor.
Is that enough to just check on his?
At least that's the beginning is better. At least you know what what he would do is scientifically correct, or agreed by the plastic surgery community. There are set rules.
Does it matter if this person is affiliated to the Association of Plastic Surgeons of India? Does that qualify for anything?
Yeah, I mean that would qualify. Yeah. That's okay. That doesn't tell you the skill of the patient.
Okay.
It's just that he is associated with the...
Because, unlike the West or other parts of the world, in India, because India has banned before after posts on social media, and you can't...
Now, recently they have banned it, yeah.
So it becomes very difficult to then actually figure out what kind of work this doctor...
Go to that surgeon, to the surgeon, and he will show you his work.
Oh, he'll show you
there I can show. Yeah. I mean, there a surgeon can show. You're not allowed to put it on the internet.
You're not allowed to publish it.
Yeah. So you go and you see the work, what he's done. And if you're so unlucky, you go to a surgeon who shows somebody else's work, then it's... Well, there are people who do that.
Really?
Yeah. There are people who do that. So I've seen my patient's picture somewhere else. Yeah, that's why I'm saying.
Thank you for spending time with me. This is a wonderful conversation.
Most welcome, and thank you for having me here. It was great.
Very good luck.